You're listening to the Wilmac Wire, the podcast that's designed to give you a glimpse into a growing SaaS company, specifically in the realm of customer interaction technology. From customer experience to data management, we'll talk about it here. Thank you for tuning in.
Good morning, good afternoon, good evening. Thank you for tuning in to this episode of the Wilmac Wire. My name is Emily Miller, and I am just introducing today's episode as we share another event recap. This one was an in-person event from October 24th, and the event was titled Digital Health in the Contact Center, an Opportunity to Advance Health Equity. So the conversation was with 4 panelists: Dr. Lonie Haynes from Rochester Regional Health, Dr. Thomas Green from Anthony L. Jordan Health Center, Roni Jamesmeyer from Five9, and Christina Cavaleri, our very own, from Wilmac Technologies, who you've likely heard on the podcast before. So the 4 of them had a conversation that revolved around AI and contact center technology and how it helps improve patient engagement. So the conversation itself was great. It's a little lengthy, so I'm going to keep this introduction quick today, but I wanted to thank them all for joining us again a few months back for an awesome discussion. So you're in for a good episode today. Beyond that, I just wanted to mention that this is the last episode of the Wilmac Wire before 2025. Our next season, season 2, is going to be starting and launching on January 9th. So you got a few weeks break to relax during the holiday season, but we're coming back to you with newer and better and awesome episodes that revolve around really the problems that we're seeing in the industry, chatting with our internal folks. Bob Pease, our VP of Engineering, sharing updates on Continuity Replay and its rapid development, chatting with our sales reps, our service team about what they're seeing in the market, and then even customers and partners and the challenges that they're helping and what we're working with them to help navigate. So our next episode will be January 9th after this one. Like I said, the start of season 2, which is really exciting. So in the meantime, I hope you enjoy this episode of the Wilmac Wire. I wanted to wish you a very joyful holiday season and just thank you from the bottom of my heart for listening to the Wilmac Wire. When this episode releases, we'll probably be having our holiday party at Wilmac Technologies. So just like I said, wishing you a joyful holiday season that's merry and bright. So again, thank you for tuning into this episode of the Wilmac Wire. And I'll be back. I'll see you January 9th. All right. Thanks.
Hey, everyone. My name is Steve McDonald. I'm the CEO of Wilmac Technologies. I just want to say a quick few things before we get started. Please be patient as we're hearing people are struggling with the parking lot. So you might get some people coming in during this great panel discussion. So appreciate the patience with that. We're super excited for this today. Our team's been planning this for over a month now. Very excited for the panelists. Thank you guys for coming. I know everybody traveled quite a bit, so really appreciate that. One of the cool things is having a partner and a company like Five9, one of the most advanced contact center technologies in the country right now, out of California, here in Rochester, to discuss basically how we can improve our healthcare contact centers in Rochester. Also, what we will hear today is kind of great technology stuff and then some real life problems going on in the real world today, which I think is a gap we miss when we're selling technology a lot. So very excited to hear about that. And then how Wilmac kind of fits in the middle. We want to bring this type of technology to Rochester to help the Rochester community. But it's tough. It's not a plug-and-play type of technology, and these companies really need smaller companies like Wilmac to help them crawl, walk, and run with this type of technology. So with that, I'll hand it off to Barbara. Again, thanks everybody. Thanks everyone for coming. Thanks for the panelists. Really appreciate it. Hope everyone can stay after and talk. And thanks.
Thank you again. Thank you, Steve. And again, thank you to the panelists for joining us today. I just want to put a plug in. There's still plenty of coffee and pastries out, so feel free to get up and help yourself. And we just want to make sure you guys enjoy that. I'm just going to do a quick overview. The focus of today is how can we leverage advanced technology to improve our health equity metrics, right? So we're finding at Wilmac that the conversation of health equity and the conversation of advanced technologies such as artificial intelligence, AI, are still surprisingly siloed. Whereas they're both two aspects within healthcare that are heavily invested into by institutions. So we need to bring these conversations together into one topic, and that's what we're going to be doing today. And I'd like to introduce our panelists. We have Dr. Thomas Green from the Anthony L. Jordan Health Center, and he currently serves as the Chief Equity and Engagement Officer. So we are very honored to have him here today. We also have Roni Jamesmeyer. She's an expert. She has worked with many large healthcare institutions to do exactly what I just mentioned, and that's to leverage technology to improve many aspects of their metrics, including health equity and population health. Very interesting. If you haven't spoke with her, you need to. She joins us from Dallas, Texas. So we're really honored to have her. Then we also have Christina Cavaleri. She's with Wilmac Technologies, and her expertise is working with healthcare institutions to leverage technology. So she's very hands-on of the day-to-day operations. This is what my goal is. How do I do it? What technology do I need? And she does that every day. So she's another great person if you pick her brain after and talk with her, because I'm sure she can help you. And then last but not least, we have Dr. Haynes, and he joins us from Rochester Regional Health, and he serves as the Senior Vice President and Chief Diversity, Health, Equity, Inclusion, and Justice Officer. And we're honored to have him here as well. So now we're going to just jump right in. I know we started a bit late, but I'm going to hop right into the questions, and we will reserve some time at the end for questions and answers. So we look forward to that. Our first question is going to be for Dr. Haynes. The question is, and then after I ask this question and you answer, if anyone on the panel wants to give some input, feel free to do that. How has health equity become a focus in your organization, and what steps have you taken to promote it?
So, of course, I think there's two parts of it. We look at health equity. There is, I call it the head and the heart. The head is the financial piece. What is the return on investment for us? When we talk about Centers for Medicaid, and then, of course, the federal government. Are we doing what we need to do for the patients when it comes to value-based care? Financially, what does that look like? And then the other part is what's good in the community, what's best for the community, health outcomes. And so part of our education, our learning, working with our clinicians and with our organizations, making sure we understand both of those. Why do we do it as a best practice when it comes to community health? And then why do we do it financially? Because there is an ROI to it. What happens if we don't deliver the best services to our patients? We pay for that financially. And so it's that two-prong space that I usually deliver the education and learning around. Either way, someone's going to get it, whether it's your heart or your head. I think for me, we know the healthcare space, we're going to be judged on how our patients have their health outcomes, whether it's cardiovascular disease, diabetes, all these morbidities that disproportionately impact communities of color and communities in general. And so we're very focused on making sure that we train our employees and also our team members and our clinicians the why to it, that it's not just the heart, but it's also a financial piece to it.
Mm-hmm. Yeah, I would add to what Dr. Haynes has said from the perspective of quality and reaching out to our community to make sure that they have the access and removing any social determinants of health, which can be removed by the use of technology if implemented correctly. So we have technologies internal that help with operations, and that's my operations hat. I've been the chief operating officer at Jordan Health for 4 years before moving into this title. So I see the benefits of where technology can help us internally with our operations to be able to bring better quality of health for our patients. And at the same time, on the other side of it is the social determinants of health, where we want to make sure that patients have access to quality health care.
Thank you.
So I've got just a question for both of you.
what metrics or what stats can you look at to gauge patient health, to gauge the outcomes, and therefore, how does that play into your strategy?
Well, sure. Well, for us, we do have a quality team. We have a QI team. We have a board-led team to look at those health disparities. And those metrics are shown to the board and to all of our clinicians on a monthly basis. And so by looking at those metrics and working towards those, and then being conscious of population health and using population health software to make sure that there is a focus on reducing those health disparities.
Thank you.
Same thing. I think Dr. took most of mine. Same thing. I think what's important are the dashboards. So understanding what are those morbidities that we're concerned about. And there's always a conversation too, whether it's Jordan Health, Rochester Regional, URMC, or Trillium. What are those morbidities in this county? What are those morbidities in this region that are disproportionately impacting communities? And so whether it's maternal and infant mortality, whether it's cardiovascular disease or diabetes, the dashboards help us identify that, and then we sort of try to figure out what are we going to tackle.
Thank you. So this next question is for you, Dr. Green. Not that anyone else can't chime in after he's done. But what challenges have you encountered in addressing disparities in patient care, and how have you approached solving them using technology thus far?
Yeah, I'd go back to mentioning the social determinants of health, right? And trying to address patient care. And if we go back even several years ago when COVID started, where there were challenges even before that, and now we've got our patients who are dealing with housing and work and transportation, and childcare, education, and so many other factors that are affecting their concentration on their own health and affecting their own health and affecting their own mental health. We had a conversation over at Common Ground Health on yesterday, speaking about what those factors are in terms of people's mental health and what is affecting them in terms of that. And so, yeah, those challenges have been there for years, but now they were exacerbated by COVID. And now I think there's still some lingering effects for people who are still dealing with that. And it'll probably be for a long time before they'll be able to actually overcome some of those effects of COVID. But those are some of the barriers. I see those as some of the challenges that marginalized people in the community have in particular, where you were worrying about some of these things before, and now that that's happened, now you have to really try to work a little bit harder to get over those hurdles.
I would agree. I think probably one of the best things I could see AI working with us on is around social determinants of health. So when you look at patients, 80% of their morbidities have to do with outside the hospital system, where they live, their transportation, do they live in a food desert? Those are areas that we're trying to work with our community partners on, and love to see how AI can help us advance that much more effectively, identify those areas that we can sort of intersect with.
Thank you. It just makes me think like a company like Wilmac can be a great resource, because I understand there's a lot of every institution has different infrastructure, but whoever's supplying that to them and consulting them should be very deeply ingrained in this type of conversation with you all. Because if they're not working with you to help improve those metrics, then it's like, it's so important to track it all the time and know what's out there. Like, you should know what technology is on the roadmap, what's coming, what tools are out there available for you. So, and that kind of like leads me into my next question, which is directed toward Roni. So how do you see the role from being a technology provider? How do you see the role of contact centers evolving to support institutions to achieve like metrics like health equity and improving patient engagement and care delivery when it comes to leveraging like AI and the different resources that are available?
Yeah, that's a great question. So, contact centers and call centers have traditionally been, voice, right? The caller in. And it's really all about communications with your patients anyway, trying to reduce the frustration that
people have when they call in or communicate with their health system. We all want the Amazon experience that you get in retail, where it's simple, it's easy, it's frictionless, and healthcare is different. It's unique. And so those are where we're striving to be there, from a communication standpoint. But where we see the contact center and our role in helping with healthcare and helping some decrease some of the disparities is in the communication journey. So you may have heard the term omni-channel, because it's not just voice call anymore, right? There's SMS, texting, there's email, there's social media, there's other ways to communicate with patients of various age groups. And that's called omni-channel, or we'll look at it as maybe the right channel. What's the channel that is most effective to reach Roni, that'll get her to answer a call or to be compliant in her care? Because really what we're trying to do is help them be compliant in their care. We can do outreach. We can do specific targeted outreach to the morbidities, like we can do general outreach to the community for well checks, get your flu shot, etc. We can do very targeted outreach to, say, diabetes, or some of those, or Medicare or Medicaid communities, right, where we have targeted messaging to that group. So it's focused on just those folks that you want to try and reach. We can do outreach for appointment setting, or outreach for scheduling transportation. We'll talk about that a little later on another question, but also education, where to get it. So part of it is, how do we reach these folks? The key is, how do we reach them that means something, right? That they'll respond to, about where education is, about where the data is, about the upcoming new clinic that just opened up and the hours are, etc. Right? Having that targeted outreach for it. And all along the way, having the reporting metrics so you can populate it in your dashboard. Because I think a lot of health systems, some of the technology now doesn't have the reporting capability, so they don't know. You can't fix something if you don't know where the problem is. So with call centers and the communications that we have now with AI, with self-service, you can be 24/7 if you want that, right? You can do self-service at 3 a.m. for those that are night owls, and save the workforce, but you can also collect the data and have it in real time. So you can say, hey, we need to spend more time here, or we're missing something here. And it's a journey. But those are some of the areas, and AI is very prominent in those areas.
Thank you. And I have a question for Christina, a second part to that question. So how can you see consultants, organizations to support, to be like that middle, that liaison between the technology and the healthcare institution, from your experience in operations?
So in my experience working with organizations in healthcare and other organizations, it's really about that partnership. It's understanding and being that true partner with those organizations, understanding what those metrics are on those dashboards, right? What are the impacting factors in those, for those metrics, for those dashboards, and really, driving innovation and technology enhancements at the strategic level. But the strategic level is one thing, right? You've got goals and objectives from the organization, but then you have, how do you operationalize your, how do you put that into perspective, and how do you put that into practice with your management teams, right? So you've got, your goals, and then how do you empower those managers, give them the tools and the resources to drive that innovation, to drive those changes that are required, and then ultimately partnering with the agents. How do they want to learn? How do they want to, or how do they learn best in order to provide the best experience? Right, like you said, it's a journey. It's definitely something that we as a consultant and a partner will step every step of the way with you. We'll be within your leadership teams to talk through those strategic initiatives. We'll go and work with your middle management teams to make sure that you're staffed in the right places, make sure the volume is going to the right people. And then ultimately, your agents are empowered to utilize those tools and that data in order to support that patient outcome the best that they can support.
Thank you. So the next question, I'm going to leave it open to either Dr. Haynes or Dr. Green. So Rochester is a sanctuary city. So, and we have a lot of people who are in our healthcare system, a part of our population who English may not be their first language. They might not even speak English at all, and so they might be intimidated and not know how to get proper access to care, and then end up in an ER for something that could have been preventative or something. So, considering a situation like that, what strategies have worked well within your organization to improve patient experience and population health equity within those type of communities? And what role has the data played in these strategies?
Dr. Haynes, I want to go first because I want to piggyback off the comments that they said and hopefully answer your question because it's important. I really believe that AI is going to be a game changer in this area and in terms of even contact centers. I see that. I believe that it's coming. I was speaking to someone outside earlier about I got my bachelor's degree in computer science from SUNY Brockport, and we had the old IBM mainframes. And so when I think of where technology has come today, did we ever see it? I remember when I first started working in City Hall, we had typewriters, and we started moving into desktop computers. So technology is moving, and AI in some ways is moving faster, I think, than we can put the regulations and the controls behind it. So this is definitely going to be a game changer of what they're doing. And in terms of what is happening at Jordan Health Center, we have a contact center. We do messaging out to our patients based on the modality that they have approved. So we can't text them if they didn't say you can text them. You can't call them if they didn't say. So those are some of the barriers we were talking about earlier that obviously, and we can get past these things quicker with AI and some of these solutions. But I think that taking that and taking it to the next level, and you talk about our marginalized communities, they also have to have the access to receive, right? So we can send things through, and we do this now, okay, your appointment is whenever, or we want to see you for this or that. But if you cannot communicate because they don't have the technology on their other end, that can be a challenge. But I see where AI is going to be huge, and where companies like this can help us to get there and help us to get past these barriers, and that marginalized communities will be able to better access the information. Going back to the language and language barriers and things of that nature, I had a personal learning experience about a week ago, and I was in a huge group of a conference, and there were some people who had an interpreter, and I was speaking to them, and I was trying to be very, I thought, professional and cordial. So I was speaking to the interpreter, and very quickly they said to me, "Don't speak to the interpreter, speak to us." And so that was a learning experience for me. And it also, our conversation at that time was regarding, we have language interpreter machines throughout the organization, or you can pick up a phone, or I have on my smartphone where I can dial in and I can get that. But it's just like our community health workers. There's nothing like the human touch. There's nothing like having somebody who can actually come and interpret for you. And we have certified Spanish interpreters. I'm sorry. And we have the machines, again, that we can bring. But again, there's that human touch, and we ask, where can that technology be taken, even though it's there to be able to help in that way? We do appointments online, and we have some kiosks that we're ready to roll out. But those things have to be in a way that we can reach everyone, not just those where English is your first language. We have to be able to reach others, and that's where our challenge is as we move forward. That's where our challenge is as we're going to implement AI, because I believe it's going to be a big game changer. But we have to keep everyone in consideration when we're looking at these technologies.
Yeah, thank you. And let me tack on with that is in the contact center of an AI, there's a lot of AI is doing a lot, like a virtual agent is what we call it. It's the bot that's in front of the agent. So the bot could be helping with authenticating, and it's doing it right now. So AI is doing a lot of this right now, taking a lot of low value, if you will, the authenticating that Roni is who she is before you address what Roni's calling in for, right? And that's the authentication. Agents don't need to do that because they need to spend their time on the higher value, the critical access part of managing the call. So AI is very exciting. Multiple languages, being able to do, I just lost my train of thought. The analytics of predictive analytics is where I'm going. Insights, where they can take keywords and anticipate what your needs are. So that we're getting there. It's doing what I'm seeing right now is basic block and tackling. We're basically doing a lot of what we call call steering. There's still a tremendous problems with press 1 for sales, press 2 for IT, press 3 for support. By the time you get to 6, I forgot what 1 was. And then I am like, out of all 6 of them, none of them fit my needs. So what do? I press 0, 9, or pound, and I get out, or I get stuck, and I get frustrated. Yeah. And you don't want that. And I call back in. And that's still a problem in 2024. And so a lot of the AI can mitigate some of that with, I understand you're calling in. Can I help you? What are you calling for? I heard you say you want to talk to Dr. Smith. Is that correct? Right? And you get it routed. Believe it or not, that is still a huge problem of what we're trying to solve for today with our customers that are using automation. But there's so many other things from a health equity standpoint, being able to do language, the different languages, being able to integrate with back-end systems like population health, being able to have that flexibility of integrating so you have the data and you can use it to improve an outcome. Because really what you want to do is, tech is great. You want to replace old tech for new tech because of what it can afford you now. But you also want to figure out, to your point earlier, is how can I improve an outcome? What is a metric you're going for? Is it an HCAP score? Is it a readmission? Is it referral leakage? Is it transition of care? What are those top metrics that you have, that you care about, that you're trying to improve? And how do we operationalize it on the contact center side, on the communications journey? And we can do that. It's a journey. It doesn't happen overnight. And it takes other people. It takes your EMR vendor and your other vendors that you work with. But taking and how do we move the communications journey to improve an outcome is absolutely what we do and work with our partners to do. We're a partner in that regard with Wilmac to do that.
Thank you.
And if I could just add on to
well,
Ronnie.
unfortunately, we can continue the conversation upstairs in the luncheon, but I had to keep it going. I'm so sorry.
I am going to give you an example
upstairs
of a success of what she's talking
so
about.
Make sure you come. So next question is actually for Roni. What role does state and government have in addressing and supporting health equity initiatives, specifically with technology?
Well, I can answer part of that. I know we do have a customer in New York, in the city, that has a Medicaid contract with Medicaid, and they provide transportation. They take over 6 million calls a year, about 46,000 rides, and they work with 5-9. We displaced one of our competitors, Genesis, in it because they were having fraud issues with voice biometrics. Again, the authentication part of being able to help. They're trying to do is get people to their appointments and provide transportation that Medicaid's doing. So we're doing the scheduling, the rescheduling, and either the caseworkers are doing the scheduling or the user is doing it. That's where the voice biometrics comes in. If the caseworker is doing the scheduling for the patient, that's one route. But sometimes the patient has to call in and reschedule or do repeat recurring appointments and stuff like that. Very successful, and they're all trying to hit the underserved communities. So we're really working. They're out in Long Island and in the tri-state area. And that's a great success story on how we are trying to work and push, that type of environment to help the Medicaid and the underserved community from an IT perspective.
Thank you. Next question, again, I'll leave it open. Actually, I'll point it to Dr. Haynes. And of course, Dr. Green, if there's time, you can chime in. So, what lessons can other healthcare organizations learn from your specific approach to balancing patient experience and operational efficiency? And I'll ask it this way too, because I know a lot of us, like healthcare institutions, have been on the same system for 10 years, 15 years, and they're just adding on and not really, I guess, maybe I won't say they're not considering, but is it open-mindedness? Is it better education? What is your perspective on that?
Yeah, I think it was mentioned earlier too. We go into this work being very presumptuous about communities and patients we work with. I think the most important is really partnering with your community-based organizations. Mm-hmm. The CBOs who are out there, who we call boots on the ground, they know the communities, they know the individuals. And our best work is working with them. If we don't engage them and really partner with them, it's our fallacy. I was just mentioning out in the lobby, we had a meeting this week talking about the 5 languages that are most profound within our hospital system. Of course, English and Spanish, but then Ukrainian, Nepalese, and Vietnamese. And ensuring that we have community-based organizations that we're connected with, that we understand all the cultural nuances. And if you don't do that well, the health outcomes are going to be stymied. And so to me, that's probably the most important space.
And what role does technology play in that? And again, I ask as far as where does the forward thinking come into play?
So, right now it's very limited, except internally within our system. A future goal would be to have that type of technology that would be out there with our community-based partners, because they're small, underfunded, mm-hmm. and connecting with them is critical. And so how AI can engage them and make sure that we're better partners is a future that I'd like to see.
Mm-hmm. All right. And then our final question is for Christina. How can healthcare leaders drive change and technology adaptation to better support patient care and equity? And I'm asking you because, again, you are hands-on every day in the day-to-day operations of bridging the gap between the technology that's available and working with healthcare leaders.
Yeah. Bridging the gap in technology innovation with healthcare leaders, it's really a true partnership. It's getting into the day-to-day operations of the organizations, understanding what is driving the changes and what is driving the initiatives, right? You mentioned your community-based operations, right? Your partners. How can we partner with them to be able to give you the right data so that we can run the AI tools and really make those predictive analytics useful in the organization? It's, providing that AI layer for that data. Then it's also, your middle management, and how do they make changes and how do they make decisions on how to support those patients? You mentioned the language barrier. Language barrier is huge. And if you've ever tried to communicate with a patient that does have a language gap, it's hard. It's not easy. It's stressful both on the person that you're communicating with and on the agent. And how can you make that process easy, whether it's through authentication, whether it's through, an AI solution that, an AI translator. So it's really kind of understanding kind of what goes into that decision-making layer, and then utilizing that, making sure that it's successful, putting KPI metrics behind those decisions, and then also empowering the agents to utilize them, right? We can make all of the technology advancements and the innovations, we want, unless the agents are trained well, they know how to use it, and they're held accountable to it. All the innovation in the world won't be successful unless your agents and your populations that you're working with are aware that the technology is out there, that you're able to provide those services, and that's where we can partner.
Thank you. Tack on to what she said, from a 5-9 perspective on the call center, we've been doing AI automation since before COVID. We started tinkering around with it with our own technology since before COVID. And in the last year, I went back to every single healthcare customer that's using it. Not everybody's using it. About 20% of our healthcare base is using AI and automation today. And by that, I mean a virtual agent in some capacity. So I went to every single one of them and I said, why did you buy it? What pain is it solving for? Did it solve for the pain? How do you know it solved for the pain? What metrics did you use to judge it against? And what lessons did you learn? What would you do differently? We published an e-guide, a healthcare e-guide in June. The QR code is on a little business card out there with the ebook. You're happy to download it, but it's got a lot of ROI metrics and measurements of use cases and true stories and true metrics. Not every metric or ROI was financial. One metric was just patient satisfaction in the mother-baby department. They said, we have breast pumps, we deliver breast pumps for expectant mothers, and all the calls were coming in. We email them with this information. It's on the website. It's in 7 different places, and yet they call. So they just really wanted to make those expectant mothers less stressed, and they used a virtual agent to point them to where the data was. And that was the entire reason they bought it. There was no metrics or financial other than the patient satisfaction part of it. But the point of the e-guide was for twofold. Healthcare are typically laggards. We've been all coming out of COVID. We know we're all stressed and got other problems, but we wanted the healthcare community to know that, hey, you're not the first, second, or third out there. It's out there. And 2, that the metrics are there and the value is there. There is real value, real ROI on using automation. A lot of it is call steering. A lot of it is authenticating the caller. There's some appointment scheduling and stuff like that. You can read it. But there's also a straw man in there. If you're kicking the tires or you want to think about putting a project together, there's a straw man template on how you would consider doing a project of your own when you're ready. And we'll be updating it next year because I got about another dozen ROIs to collect and stuff like that. But it's really good. It's just a testament of that. It's only going to get better. It's going to be used more in a safe environment because we're not dealing with any type of clinical diagnosing or any of that. We're basically doing it for helping with the patient experience and the communications journey. But it's only going to get better.
Thank you. And I know we have. Oh, did you want to add something?
No.
Okay. And I know we still have so many questions. Like we are hearing about this great technology, but who's going to fund it? And then once it's funded, how do we sustain it? And those are the kind of things we could talk about upstairs, if you like. And again, thank you for attending. And that was our final question. And now we can open up to a Q&A from the audience.
So, Jeff Freeman from Brown Health, and one of the questions that came up for me as you guys were discussing around language access is, you may not have an answer, but how does AI improve sign language communication?
It's going to have to be visual, I would think, right? I mean, we're going to have to do visual, right? There's going to have to be video there to be able to translate. That's a good question. I have not been asked that before yet.
Yeah.
But I'm going to take that one back.
Yeah.
And because it's probably been asked, and I don't know if we can invest in it right now. Can you?
But I've been witnessing some language where the video is capturing the hand gestures and being able to interpret that and use it as software. So it's early days, that is out there. I do see it coming to the video and that's really.
Yeah. In addition to that, it's the predictive authentication as well.
Yeah.
If you can identify the caller, may have a visual or an auditory impairment, you can then trigger that to go to a video agent who is trained in, providing the sign language interpretation, or is certified in the language as well. Rochester is a great community for that community as well. We've got quite a few different agents that are supporting the organizations today through sign language interpretation.
Yeah.
And I would just add, that's one of our shortcomings, right? With what we're doing now is because we have the display, the screens, and you can see it if you're in with the doctor, with your provider. But if you're in a call center, we don't have anything there that supports that. So that's where I look forward to the future of AI being able to really assist with that and other language barriers that someone may have. Because when somebody calls in, we don't know what language you're looking to speak in. And unfortunately, we have people who speak Spanish and people who speak English. But now there's our opportunity through AI to be able to better support people right off the front end.
Right.
And I would imagine too, 10 years ago, we had cell phones. We didn't know we could speak into them and translate to different languages. I could imagine from an AI standpoint, very quickly, that you'd be able to speak into the phone and have a screen that would do actually the ASL language interpretation. I mean, who knew what we were doing 2 or 3 years ago? It's moving that fast.
Yeah.
I just want to add to that. So, Wilmac from 5'9". So I actually had a question from another customer on the same situation. Unfortunately, the ADA still recommends the TTY devices because that's the only technology. And that requires analog lines to the home and so forth. And contact centers typically are not integrating these TTY devices anymore. So what's happening is the community actually seems to be driving more of the technology than anything else. And so what we call digital engagement or chat from a website seems to be doing that because the advantage there is either through direct communication to a human agent or through a chatbot. We can support different languages automatically. And on the chatbot side, it can communicate with the language they want to do. They can preemptively say, what are you looking for? How can I assist? And actually drive a little bit more of the conversation before it does hand off to the live agent. At which point, again, it's that digital engagement there. So we're finding that the community is starting to do more of their own, of figuring out how to do it instead of the government trying to help provide needs. So.
Mm-hmm. And that goes back to what we talked about earlier. You get your information from the community. Our patient and our communities are going to tell us how to best service them. And that's that whole cultural competency piece. Listen to the patients that you're serving in the communities in which you operate in.
So, Roni, I think earlier you mentioned about the Amazon Wire experience, right? That's what we're striving for. And Barbara, you had mentioned sort of post-COVID, post-COVID, how the world has changed and access is an issue, right, when it comes to equitable care. So my thoughts jump to telehealth, right? So what are your thoughts about AI when it comes to telehealth? We've talked a lot about telephonic linguistic interpretation and discussion, but above and beyond that, we think about AI being an efficiency, right? Do you foresee a world where we've got, AI rendering telehealth care, whether it's social or clinical in nature, and what are the implications there?
Boy, jump in here anytime you want. Yes, I mean, video is definitely not going away as far as another option for a channel, if you will. I absolutely see that in the telehealth space. I'm just trying to stitch it together. I was thinking of where I see AI is doing a lot. It's right now AI is like what I would call single threaded. It's going to do one thing. It's going to authenticate me, or it's going to check back at an appointment or whatever. But what we need AI, where it's going is to be multi-threaded, where it can sense that I'm stitch together the conversations to say, why is everybody who's calling about this particular drug angry or anxious, right? And kind of fill in, put the complexity together, or put the multi-threaded in. If Dr. A isn't available for my shoulder on Thursday, I need who else is available at this clinic with this specialty on Thursday, and be able to go into the different areas and find that data. Right now, it can't do that because it's pretty siloed. And so hopefully AI can go and get that information. You got that where it's going to go do the searching and find it. So that's more, I don't even know if I answered your question, but that's where we're going with a lot of AI and how that telehealth is another component.
Yeah. So I'm sorry. No, go ahead. I just want to ask before we get past the telehealth, because we have telehealth, right? And many of us have been doing and the technology is great. I remember when we first started installing it, you could hear a heartbeat so well. You could look at the skin, and it's like, wow, this technology is great. And at some point during COVID, the reimbursement rate was the same as a visit, and as all of those things changed on us, right, it became different. But I do see a world where telehealth, as Roni was saying, will allow us, even in terms of scheduling with a patient, to be smarter through AI and how we do that. And so, I should say this: Jordan Health is a community health organization that's part of Chicane's Community Health Center Association of New York State. And as part of that organization is looking at, you can go to their website, Chicane's, they're looking at these technologies and AI as it comes along. And they're spending money in certain areas where I was going to say earlier, to Roni's point, is I was in Saratoga a couple of weeks ago, and one of the organizations did they were funded to do a study on chatbot, and it was successful. So they didn't do it for the whole organization. They only did it for a segment of the organization. But those are the type of things that show that AI has such great power. Their concern was, again, getting ahead of maybe the regulations and the policies, or making sure that you have those things in place, just like you would with any technology or anything you do, because Lord knows we wouldn't want AI to give out the wrong information and somebody loses their life as a result of it. But there are many case studies and examples of where AI is certainly moving in the right direction. And I wouldn't doubt if we couldn't find the same thing with telehealth if we look deep enough.
Well, thank you. So unfortunately, we don't have any more time for questions. However, upstairs on the 10th floor, we are having a luncheon, and we will have available Roni and Christina. And if you want to discuss the initiatives that Dr. Haynes and Dr. Green are doing at Anthony L. Jordan Health Center or Rochester Regional, they'll be upstairs as well. So please, and if you can't make it upstairs, I understand, but you do have additional questions, outside you can find Lada, and we will follow up with you to continue the conversation. And we actually created, I'm not sure if you're aware, a digital health assessment. So we have all of these ideas and plans, but sometimes you need to mark an X on the spot, on the map, to know where am I at today on this roadmap. So outside is a QR code where you can scan and actually complete a digital health assessment. A passing score is about 65. So that'll give you a good idea of where you are, right? You might think you may have invested a lot into your infrastructure and find out, wow, after answering the questions, I'm not really where I should be after this investment, or complete it and say, I need to begin my journey. So I really strongly encourage you to complete the assessment. The results are for you, that your answers remain confidential and private. You could use the assessment internally to create a path, but it is available for you to do. And for those of you who would like to join us for lunch and maybe fill out the assessment upstairs with us and have a conversation with our technology experts upstairs, it's going to be on the 10th floor, and we can direct you to the elevators. But thank you so much for your time today. We appreciate it, and enjoy the rest of your day.
Thank you for joining us for another episode of the Wilmac Wire. Make sure you never miss an episode by subscribing on your favorite podcast platform or visiting our website at www.wilmactech.com. You can also watch the full video recordings of every episode on our YouTube channel. Thank you for being a part of our community, and again, thank you for listening to the Wilmac Wire.